The following video provides an anatomy revision resource focusing on the anatomy of the lower leg, before diagnosing an injury sustained to the lower leg during exercise. This anatomy revision resource will be broken down into sections to help provide an in-depth overview of the lower leg, starting with the osteology of the lower leg, followed by muscles of the anterior compartment, lateral compartment and posterior compartment. We will then spend a short time talking about the blood and nerve supply.
Bones of the lower leg are made up of the tibia and the fibula. The fibula sits laterally to the tibia and is made up of the head, the lateral malleolus, which articulates with the talus, and the body known as the shaft. Between the two bones lies the interosseous membrane. This separates the muscles on the posterior and anterior portion of the leg. Tibia is the major bone of the lower leg. At the top we can see the medial and lateral condyles. In between is the intercondyle eminence. At the posterior view of the tibia, we can see the soleal line, and at the bottom is the medial malleolus. The anterior muscles of the lower leg, including the tibialis anterior, the digitorum longus, and the extensor hallucis longus, originate from the tibia and the fibula, and they insert into the dorsal side of the foot. The lateral muscles of the lower leg originate mostly from the femur and insert into the lateral aspect of the foot. The posterior muscles of the lower leg mostly originate from the tibia, including the soleus, which originates from the soleal line, the popliteus, the tibialis posterior, the flexor digitorum longus, and flexor hallucis longus, and they insert into the calcaneal tendon.
The tibialis anterior muscle is located alongside the lateral surface of the tibia. Its actions are dorsiflexion and inversion of the foot. The extensor digitorum longus lies lateral and deep to the tibialis anterior. Its actions are extension of the lateral foretoes and dorsiflexion of the foot. The extensor hallucis longus is located deep to the extensor digitorum longus and tibialis anterior. Its actions are extension of the great toe and dorsiflexion of the foot.
The fibularis tertius muscle rises from the most inferior part of the extensor digitorum longus. It is not present in all individuals, although it is a weak dorsiflexor and inverter of the foot.
In the lateral compartment of the leg, the fibularis longus is the more longer and more superficial of the two. Its actions are eversion and plantarflexion of the foot, also supports the lateral and transverse arches of the foot. The fibularis brevis muscle is deeper and shorter than the fibularis longus. Its actions are eversion of the foot. The posterior compartment of the leg contains 7 muscles organized into 2 layers, superficial and deep. The 2 layers are separated by a band of fascia. Collectively, the muscles in this area plantarflex and invert the foot. The superficial layer. The gastrocnemius is the most superficial of all the muscles in the posterior leg. It has 2 heads, medial and lateral, which converge to form a single muscle belly.
The plantaris is a small muscle with a long tendon, which can be mistaken for a nerve as it descends down the leg. It is absent in 10% of people. The soleus is located deep to the gastrocnemius. It is large and flat, named soleus due to its resemblance of a sole, a flat fish.
Deep layer. The popliteus is located superiorly in the leg. It lies behind the knee joint, forming the base of the popliteal fossa. Tibialis posterior is the deepest and it lies between the flexor digitorum longus and the flexor hallucis longus. The flexor digitorum longus is a smaller muscle than the flexor hallucis longus. It is located medially in the posterior leg. The flexor hallucis longus muscle is found on the lateral side of the leg. This is slightly counterintuitive as it is opposite the great toe, which it acts on.
The femoral nerve terminates before the lower limb of the anterior leg. The sciatic nerve runs posteriorly, moving round to the anterior at the knee. Here it divides into the deep and superficial peroneal nerve, which then divides again into the medial and lateral dorsal cutaneous nerves of the foot. The tibial nerve runs posteriorly down the back of the leg. The femoral artery runs centrally down the thigh. It then runs posterior to the cubital fossa, becoming the popliteal artery. After this, it bifurcates and the posterior tibial artery runs down, eventually becoming the medial and lateral plantar arteries of the foot. The second division of the popliteal artery runs anterior beneath the patella, becoming the anterior tibial artery.
The subject experienced pain in the back of the leg, which suggests a strain to the calf muscle. As the patient can feel sensation in all areas of the leg and foot, we can eliminate nerve damage. In order to confirm the injury, the subject is asked to plantarflex his foot. Pain experienced in the back of the leg during this motion suggests that there is a strain in one of the muscles in the posterior compartment of the lower leg, such as the gastrocnemius or soleus.